So let's come back to why do we have to stay at home? I know for many families, everyone's getting a little bit crazy because you have everyone sitting at home day after day. No one's going to school, no one's going to work, and it becomes very stressful because of that. But the reason why we have to stay at home is because for two reasons. One is not to infect others outside, and the second one is not to become infected by people who are outside. By people staying at home, the virus doesn't have a chance to mix and to spread in the community. And so by staying at home for a period of time and we monitor where the virus is going, we can control the virus and prevent people from dying. We can use examples that we know. Our neighbor, Iran. Iran right now is facing a huge epidemic of coronavirus in the country. The hospitals are overwhelmed. The mortuaries are overwhelmed. The whole system is being overwhelmed because of so many cases. In Iraq, the government has done a fantastic job in trying to manage the outbreak of coronavirus and ensure that we don't have the same kind of huge national problems that some of our neighbors are facing. And so, I mean, for me as an epidemiologist, for someone who studies disease, I've been very encouraged by the guidelines that the government has provided, but equally by the people of Iraq, because they've stood by those guidelines and people have stayed at home and prevented a situation like we see in Iran right now, increasingly in Turkey right now. We don't have that situation because people are helping to follow guidelines and stay at home. So those who are in the military, those who are our frontline responders in this emergency, and those frontline responders are our nurses, our doctors, our social workers, those who are risking their lives for the lives of others. So this is, for this group of people, they're meeting people all the time. And so it's important that they have their gloves, it's important that they have their masks at a minimum, okay? And for this reason, we don't want to go and buy as individuals, we don't want to go and buy all of the masks in the pharmacy, because we need to ensure that our healthcare providers and our frontline responders have the protection that they need to support us, okay? So it's an investment. So we need to leave the personal protection equipment, leave that to the professionals that are taking care of our loved ones. And so for this reason, we want to ensure that we allow the healthcare providers to use that equipment, because remember, we're importing most of this. And so we want to ensure that it goes to the most important people. And so we want to allow them to use this equipment, and we need to stay at home during this time.